Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farhan bin Muhammad Jamil. My matric number 1172067.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Iqbal bin Ahmad Rianto and my matric number is 1172088.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Aina Shakirah binti Muhammad Zaini. My matric number is 1172097.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Zaitun binti Muhammad Ismail. My matric number is 1172089. Today, our group will be presenting under the topic of COVID-19 social impact in Malaysia. Introduction. In 2020, there will be an unstable situation where people are affected with this situation, which is the spread of coronavirus COVID-19. Malaysia is one of the early countries had been affected with this pandemic until make the country become unstable in the state of politics, economic and society aspects. The COVID-19 outbreaks affects all segments of the population and particularly detrimental to members of those social groups in the most vulnerable situations and continues to affect population including people living in poverty situation, older persons, person with disabilities, youth and indigenous people. Early evidence indicates that the health and economic impacts of the virus are being borne disproportionately by poor people. For example, homeless people because they may be unable to safely shelter in place are highly exposed to the danger of the virus. People without the access to running water, refugees, migrants, or displaced persons also stand to suffer disproportionately both from pandemic and aftermath, whether due to limited movement, fewer employment opportunities, and others. If not properly addressed through policy, the social crisis created by the COVID-19 pandemic may also increase inequality, exclusion, discrimination, and global employment in the medium and long term. Comprehensive, universal social protection systems, when in place, play a much role in protecting workers and in reducing the prevalence of poverty since they act as automatic stabilizers. That is, they provide basic income security at all times, thereby enhancing people's capacity to manage.
Our group will discuss about the social impact of COVID-19 in Malaysia from the social group. First, older person. Second, youth. Third, person with disabilities. And fourth is indigenous people.
And moving to my first points, older persons. As you get older, the risk for severe illness from COVID-19 increases. For example, people in their 50s are at higher risk for severe illness than people who are in 40s. Similarly, people who are in 60s or 70s in general at a higher risk than the people who are in 50s. So the greatest effect for severe illness from COVID-19 is among those aged 85 or older. So the COVID-19 virus infects people of all ages. However, evidence to date suggests that two groups of people are at higher risk of getting severe COVID-19 diseases. There are older people and those with underlying conditions, medical conditions. Over 95% of these deaths occur in those who are older 60 and above. More than 50% of all the fatalities involve people aged 80 years or older. Shows that 8 out of 10 deaths are occurring in individuals, in particular those with cardiovascular diseases, hypertension and diabetes, but also with a range of other chronic underlying conditions. As a result, the impact on older adults is notable. According to World Health Organization (WHO), from data April 2020, more than 95% of COVID-19 deaths were among people over 60 years age, and more than half of all deaths occur in people who are in 80 years old age. So we can say that older people are being challenged by requirements to spend more time at home, lack of physical contact with their families and friends and colleges, temporary cessation of employment and other activities, anxiety and fear of illness of death, their own and others. It is therefore important that we create opportunities to foster healthy aging during the pandemic COVID-19.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Iqbal and now I will continue the presentation. Alright, so the next group of people that is affected by this COVID-19 is the youth. So the effect of COVID-19 basically to the youth can be divided into three, which is first to the job, second the education, and third the mental health. Alright, so the effect of COVID-19 for the job is that many young people are being laid off from their job with notice or without notice. So this affect their life because they have no salary to continue their life. Next, if they are not being laid off, their working hour is reduced, and so it also affect to their salary. Their salary also being reduced. And third, the job opportunities is not equivalent to the qualification. You know, the qualification for degree and so on, but they have to work lower than their qualification, doing such as labor work and so on. Alright, next is the impact of COVID-19 to the education. Alright, so for students, either secondary students or university students, they will not have the face-to-face session with their lecturer or teacher, and now they are learning from home by using the online and distance learning system. So they don't need to go to the school or university. But the problem is, for some fortunate student, they can have internet connection easily at home and got no problem. But for some unfortunate student, they are trying to get the internet connection alone is hard for them. So how do they cope with this new system? Alright, so and third is to the effect of COVID-19 to the mental health of youth. Alright, so people who live in the city, either working young people or students who stay in the city, cannot go back to their hometown or village due to the enforcement of movement control order by the government. So they are trapped in the city and cannot went back to their parents. So this somehow stressing their mind, and it is not good for their mental health. Next is high cost of living. Just as I explained earlier, related to the job, some of them have been jobless and no income, no salary, but they need to pay for the house rent, for their car and so on. But there is no money. So how are they going to survive? Right? So this is leading to the mental health issue. And also for some students, usually students who still living with their parents, some of them are living with the abusive parents, so they are trapped in the house 24/7 without having anyone to share the problem. Right, they are alone in the home, beating up by their parents and starving to death and so on, but there are no help. So that's all from me for the effect of COVID-19 to the youth.
Another group of people that are affected by COVID-19 is people with disabilities. The outbreak gave impacts, especially on their job. The Movement Control Order (MCO), which was implemented starting March 18, has caused many people with disabilities, especially the visually impaired, to lose their source of income. Most of these visually impaired people have skills as massage therapists, and with the government's order to close massage parlors and entertainment centers will definitely result in these people losing their source of income. Next, the MCO period also challenged people with speech disability, especially in the context of social distance. It is not easy for the disabled because they need to interact with a second or third person. As an example, the hearing impaired need sign language all the time, and the visually impaired require other appropriate narratives.
Okay, we move to the last group, the ingenious people. The ingenious people is First People or First Nation of ethnic group. Okay, generally in Malaysia we call it as orang asli, which is 10% in West Malaysia, 40% in Sarawak and 60% in Sabah. Okay, social impact of COVID-19 to them. Okay, first, limitation to doing usual activity with neighborhood. As we know, they have the spirit or they have the tradition to do something with their neighborhood that we call as gotong royong. When the COVID come, they can't do gotong royong because when gotong royong, people will be together with a huge number. Other than that, they can affect the people who assemble to get COVID-19. Okay, next, lack of internet access. As we know nowadays, we are depend on internet. How about the children from the ingenious people who are be student in university or in school, which the student need to attend the class while internet access is in the low range. Okay, last but not least, the difficulty of accessing health service and facilities. As we know, ingenious people stay in the rural area which they have or they could not have the healthy health service.
As for the conclusion, the novel coronavirus spread so rapidly that it has changed the rhythm of the globe. The most obvious consequences include economic recession, a crisis of global governance, trade protectionism, and increasing isolationist sentiment. A pandemic is not new in human history, but what makes the COVID-19 pandemic special is that it takes place in unprecedented backdrop when the interconnectivity and interdependence between people, between countries, and between continents are so deep. The achievements people have made in technology, intelligence, and transportation make them both physically and psychologically globalized. We have to admit that COVID-19 pandemic has shown us examples that lack humanitarianism. This may be due to the chaos caused by the spreading trade. However, such lack of humanitarianism seems to be deep-rooted.
That's all from us. Thank you.